Clinicals can be intimidating, clinicals can be scary, clinicals can be exhausting, but they're also your chance to figure out what type of nurse you want to be. Hey everybody, welcome back to the channel. My name is Joy. I'm a nurse practitioner living here in Houston. I make content about nursing, traveling, living here in Houston, and how to achieve your goals. If that sounds like something you're interested in, go ahead and push that subscribe button and let's get into the content. Today's video is for the nurses. It's going to cover nursing clinicals. Anybody who's gone through nursing school remembers the dreaded sterile glove test, where you have to put on sterile gloves in order to pass clinicals. That right there was the most stressful time of my life, putting on those sterile gloves. But if you're a nursing student or you're thinking about going to nursing school, this is the video that you want to watch because I'm going to give you the do's and don'ts of nursing school clinicals. Let's go. These tips will be coming straight from my own experiences, and I promise you that following them will help you in your nursing school clinicals. Okay, so first of all, what is nursing school clinicals? Clinicals is going to be your hands-on part of nursing school. This is where you're going to apply what you learned in the classroom on a patient. They say it's your first test of what nursing is actually like, but from what I remember, clinicals was more of you acting as the role of a CNA or a patient care tech. In med-surg clinicals, I remember just passing out meds with my teacher or with the nurse that I was assigned to for the day. I remember doing bed baths. I remember just talking to my patients. And I remember doing an assessment. And doing an assessment is so scary, but I remember doing an assessment on my patient. In mental health clinicals, I just remember playing games with them, talking to them, and doing an assessment. And then in my peds rotation of clinicals, we literally couldn't pass any meds. We couldn't do anything to the babies. It was really just you working with the nurse on the day-to-day and seeing what their job was like. But at my school, there was really no hands-on experience with babies. In my clinical rotation for peds, my professor asked us all what did we want to do, and I didn't want to do anything with kids, which is crazy because now I just take care of babies. But I will tell you that one professor, after hearing my answer, gave me babies every day in clinical. Every time I came to work, I had a baby. And so she changed my life. She changed my decision. She led me to the role that she felt like was good for me, and she was right. And when I told her that, she couldn't even remember doing that on purpose, which is crazy. So was it her or was it God? I mean, because God do use people in your life. So God could have been using her. I took care of babies every day. Now I take care of babies every day. So your clinicals are usually going to start in your med-surg role, and you'll be under the supervision of the bedside nurse that you're assigned to for the day and your clinical instructor. You're not expected to know everything, but you are expected to show up and try, and you are expected to pay attention and show that you want to learn. So let's get into the do's of nursing school. The do's are going to be the things that help your clinicals to go smoother and to help you have a less stressful experience. Number one, you want to make sure you're on time. And on time means early. Always be early for clinicals, no matter what. So if you're one of those people like me who show up 20 minutes late to almost everything, don't do that in nursing school. You want to be early, which is called on time, okay? The nurses notice if you're late, your professor knows if you're late, the other students in the classroom know if you're late. And let me tell you something, when you get ready to go back to school to be a nurse practitioner, you need references from professors. When you get your first job as a nurse, they may ask for a reference from one of your professors. So it's important to keep a good relationship with your professors at all times. You need to have at least 3 that you can call on at any given time who can vouch for you, and they're not gonna vouch for you if you're late. They're not gonna care about you if you're showing up to clinicals late. And let me just tell you, I had to reach out to my undergrad professor when I was struggling in my graduate program. I had to reach out to her because I was not passing the test and I didn't know what to do. So I reached out to her and she told me, you need to make sure you're practicing questions. You have to take it back to undergrad. Undergrad, when you're getting that RN, the important thing is to make sure you're practicing questions, and it does not go away when you're getting your master's. It's the same exact thing. You have to practice questions to be able to pass boards. So I was able to call her because I kept a good relationship for her. That lady's number is still in my phone, y'all. Her number is still in my phone, and I can contact her if I have any questions or concerns about nursing. When I was looking for my nurse practitioner job, they required a reference from 2 of my professors in my graduate program. So when I tell you that it's important to show up and show up right, to build that relationship with your professors, it's important. Number 2, you want to show up for the part that you want, not the part that you have. And that's with anything in life. You show up for the part that you want, not the part that you have. So that means you need to show up hair done, scrubs ironed, clean. You took a shower the day before. If you go out and party and you're drinking, don't roll out the bed and go to clinical smelling like alcohol and last night. Don't do that. You need to show up how you want to be perceived. Show up for the job that you want. You don't know who's looking at you. I mean, after clinicals, they could offer you a job if they're impressed with you. Will they offer you a job if you show up half done, half ready, half not really wanting to be there? No. So always show up for the job that you want, not the job that you have. You want to be a nurse? You don't want to be a nursing student. So show up like the job that you want. You want to make sure that you're neat, that your nails are short. And I hate it for me too, girl. Like, I'm walking around like this all the time and I can't stand it. But as a nurse, you can't have long nails with designs and all that kind of stuff. No, you need to show up neat, short nails. If they're painted, make sure they're not chipped. In nursing school, we couldn't even have painted nails. So, you know, whatever is required for your program. But you need to show up with your hair done, clean, make sure you're looking presentable. Make sure you show up with all of your essentials. You want to make sure you have a pen. You want to make sure you have a stethoscope, have a report sheet, have a small notebook so that you can keep notes of things that you don't know. Another thing that was so helpful to me is I had this folding clipboard that I could use to carry around, and it had different things on there like vitals and stuff like that, just quick reference that you can look at. I'm going to link all my resources down below so you can go to my Amazon storefront, check out under nursing tab, and you'll see all the things that I have purchased myself and that I use every day as a nurse. Number 4, when you get to the hospital, make sure that you introduce yourself. Make sure you have a smile on your face. Make sure you let them know that you're excited to be there. Try to build a rapport with the nurse that you're assigned with for the day. Ask her, is there anything that she needs help with? Is there anything you can do? Show that you're eager. Show that you want to learn. Number 5, ask questions, but not just like any questions, thoughtful questions. Questions about what is going on with your patient or what is going on with other patients. This shows that you're engaged and you're trying to learn. But when you're asking questions, just make sure that you're not doing it at a bad time. Like if the nurse seems busy, if the nurse seems stressed, don't start asking her a bunch of questions. Think about what you would want if you were a nurse, right? So if you were busy with your patient, you got a lot of stuff going on, and the student's like, well, what is this? Well, what is that? Don't do that, okay? You want to show that you're interested, but you want to show at a time when she's sitting down and not charting and not busy. You don't want to be a distraction or interruption for her. Number 6, you want to make sure that you take initiative. You want to make sure that you are offering to take vitals for her, offering to feed a patient, offering to do bed baths. These are things you're not going to want to do, but you're showing that you're interested in the field and that you want to learn. Always go observe if you can. If somebody says, hey, you want to watch this? Always go. Even if you don't want to go, always go. Number 7, you want to make sure you document correctly at all times. Learn how the charting works. Even if you can't chart yet, still learn how the charting works. Different hospitals will have different charting systems. One that's very popular is Epic. The charting system that I use is Meditech. So it ranges. People use Cerner, people use all different type of charting systems. But if you get in there and you're in clinicals and you learn how to use Epic, guess what? At your next job interview, you can say you know how to use Epic, right? So that's going to set you out from other new grads. Number 8, you want to make sure you practice all skills at all times. Anytime it's offered, practice. I'm talking about IVs, inserting a Foley, passing meds, whatever it is. If they offer for you to practice it, because you're not going to get a lot of opportunities to be able to practice your skills. In clinical, I think I only got to do 2 IVs. So you don't get a lot of practice doing it. And in the NICU, they're babies. So they're not going to let you just practice on babies. I mean, obviously the bedside nurse gets to practice once, but you don't get to just keep sticking. So when you're in clinicals, that is your time to do as much hands-on things as they offer for you to do. Always be respectful of the CNAs. They've been doing this job for a long time. If you are a nursing student and you were not a CNA first, you're kind of at a disadvantage because CNAs know how to talk to parents, patients, nurses. They know where things are. They know what supplies you need as a nurse. So if you can get a job in a hospital as a CNA while you're a nursing student, that right there is what you need to do. It's really just so that you can build your confidence being in a hospital, learn how to talk to people, learn how the hospital system works so that you're not thrown in as a new nurse and never really worked in a hospital. Also, hospitals will pay your tuition to go to nursing school. So if you can get a CNA job in a nursing school, you can get reimbursement for tuition at certain hospitals. So it's a win-win. you learn skills, and you also get help paying your tuition for nursing school. I want to just say too, you want to make sure that you work with the CNAs, not above the CNAs. You are not here to boss CNAs around and tell them to do your job. No, you're here to learn from them. CNAs are here to help nurses. And once you become a nurse, this is something you have to remember. Like, respect your CNAs, because your job is a lot harder without CNAs. It's the same way as a nurse practitioner. Physicians have to respect nurse practitioners, because without nurse practitioners, their patient load would be extreme. They wouldn't be able to manage that many hospitals and patients at one time if they did not have nurse practitioners. They're not our boss. We are coworkers. You're not the CNA's boss. You're the coworker. So respect everybody. The respect has to be across the board. Number 10, another thing that I always did is reflect after every shift. Like, once you get in the car, you can decompress, come down from what happened that day. You can reflect on, what did you learn? What did you like? What did you not like? Okay, so one thing I hated doing was taking care of adults. I hated med-surg. And in nursing school, they always tell you, you have to do med-surg before you specialize. Like, you have to. I knew for a fact, if I had to do bed baths and pass meds and talk to adults and tell them to do things all day long, I would be miserable. I knew that about myself. So this is your time to reflect on your experience and see, did I like that or not? It doesn't mean you don't like being a nurse. I tell you all the time, it does not mean you don't like being a nurse. It just means that you didn't like that type of clinical, okay? So when you get to go to the next type of clinical, maybe you go to psych, maybe you go to peds, ask yourself again, did I like that? Did I like psych? I loved psych, actually. Like, if I could redo it, I would still do neonatal, but if I could add on and it wouldn't cost me more student loan debt, I would definitely do psych, because I really enjoy my psych clinicals. So this is your time to reflect after clinicals. Get in your car and think about, what did you like? What did you not like? Can you see yourself working in med-surg? Can you see yourself working in peds? How did your clinicals go? Did you feel prepared? Is there anything that you could do different or better to make yourself a stronger candidate while in nursing clinicals? Because like I told you, somebody's always watching. Your next job opportunity is around the corner. It could be at one of these places. I definitely got offered a job at the clinical site that I did my med-surg clinicals. So somebody's watching you at all times. Keep that in mind with your behavior. Keep that in mind if you know you want to work at that location. Stay professional and stay ready to learn, and you will do great in clinicals. Now let's go over the don'ts of clinicals, because these mistakes are easily avoidable, okay? And they will get you a bad rep real fast. And everybody will be talking about you real fast. So let's go over these don'ts. Number 1, do not be late. Going back to the last section, do not be late to clinicals. Do not be unprepared. Have y'all ever been late to anything? You know how you feel when you walk in and you all flustered and you're behind and you don't know all the information you need to know, and now you're stressed out, you're sweating, you got high blood pressure, and your heart is beating 1,000 miles per minute. That's what happens when you're late. Do not be late. Number 2, do not be on your phone. There's no reason to be on your phone unless your professor specifically gave you certain apps to download that you can use as a resource. But other than that, do not be on your phone. It looks like you're not engaged. It looks like you're not interested. And it looks like you don't value the experience. Number 3, never say, that's not my patient. Y'all don't know how many times you want to say, that's not my patient. Okay, you might be exhausted. You done did everything for your patient. You've been working, and then somebody's like, hey, do you want to do this? Hey, you want to do that? And you just gotta say, yeah, I want to do it, with a smile on your face. Even if you don't want to say it, you can never say, that's not my patient, or no, I don't really want to do that. Don't ever do that. Everybody is your patient in clinicals. Every opportunity is a learning opportunity. Everything is for you. Always have that in your head. Everything is for you to become better at what you do. Even as a nurse practitioner, when I was being precepted and I would have half the patients and my preceptor would have the other half, and she'd be like, okay, so you want to go do this on this baby? Girl, sometimes I did not want to do that on that baby. Sometimes I was tired. Sometimes I didn't want to stay late. Sometimes I didn't want to document it. But I wonder what it would have been like if I was like, no, I don't really want to do that umbilical line. No, I mean, it's your patient, not mine. Why don't you do the LP?
Oh my God, bro.
Do not do that. I'm trying to tell you. It's a bad look. It's a bad look. Do not act like you know everything. People hate people that do that. Even if you were a CNA, this is still a learning opportunity for you. It's okay to ask questions and things like that. Like if somebody's telling you like, oh, this patient needs to have this drug for their blood pressure, and you're thinking in your head, well, I don't think it's really that drug. It's okay to have your own thought process and think through it, but maybe just rephrase the way you ask the question, like, oh, okay, can you tell me more about it? Because the only drug that I've learned about is this drug. So Why does this patient get this drug for it? Don't assume that you know everything, because you don't. You a nursing student. Don't avoid the gross task, because they're coming for you. Emptying bed baths, feeding patients, doing wound care, and all of that is part of nursing school clinicals. And you're not going to want to do it, but don't avoid it. Just do it, get it over with, learn from it. Stay with your nurse, learn how she do it, and take direction. Don't get involved in the politics and the gossip and all the drama in the unit. Don't talk about other staff. Don't talk about your clinical instructor. Don't talk about the other students with you. Don't even talk bad about your program. A lot of us don't like the programs that we went through, right? I mean, people ask me all the time what nurse practitioner program I went through, and I never give the name because I don't recommend it. So if that's you, keep it to yourself, okay? Don't badmouth anybody while you're in clinicals. Just stay professional, stay quiet about what's going on. If people are gossiping around you, ignore it. Or, put your head down. Don't talk bad about other people during clinicals. Number 8, do not argue with your instructor. It's okay to advocate for yourself. It's okay to ask questions. It's okay to even think that your instructor is wrong. But don't argue with them, because arguing with them is not going to get you anywhere, I promise you. And like I said before in my earlier video, you're going to need to maintain a relationship with some of these instructors. You're going to need them to get into your graduate program. You're going to need them for your first job. You're going to need them once you try to become a nurse practitioner. Like, it keeps coming back. So don't argue with them. Try to maintain a relationship. It's okay to advocate for yourself, but just watch the tone, the delivery, and what you ask and how you ask it. And above all, stay professional. And this is gonna seem a little crazy, but I gotta say it, because people, there was a pandemic. Do not forget to wash your hands. Washing your hands in nursing school is always the first thing. So if it's on a test, that's the answer. When you're walking into your patient room, wash your hands. When you touch anything in your patient's room, wash your hands. When you touch your patient, wash your hands. When you leave your patient's room, wash your hands. Wash your hands. If somebody sees you not washing your hands, it's all bad. When you're doing your test outs in clinical, putting on the sterile gloves, whatever the test out is, washing hands is the first thing you do. When you're getting ready to do an assessment, walk into a patient's room and talk to them, washing your hands is the first and last thing that you do. So wash your hands, guys. Infection control is a really big deal in nursing, and it's our responsibility to wash our hands. This is the last one. Do not compare yourself to people in nursing school. I don't know why nursing school is so competitive. We all gonna get the degree. I don't know why it's like that. But at the end of the day, it's very competitive. If you have friends that get all A's on their tests and you get all C's, a C still will get you through some of these nursing programs. In my nursing program, we had to have an 85 and above to pass. Other nursing programs, they tell me you can have C's in those programs. All I'm telling you is this: if my friend has a C and I have an A and she's always comparing herself to me, then she's not gonna be happy in her role, right? She's not gonna be happy as a student. She's not gonna be happy in her life, and then eventually she's gonna hate me so much she ain't gonna want to be friends with me no more. And this is a true story. So I'm speaking from experience. Everything I tell y'all is from experience. Do not compare yourself to people in nursing school. We're all in this together. We're all meant to be nurses. It's just come easier to some people than to do to others. It never came easy to me, but I studied. I studied like a maniac because this was the thing that I wanted more than anything. I wanted financial security, I wanted job security, and I wanted a job I enjoyed. So if that's your why, keep that in the back of your head and do not compare yourself to other people in your program. Everybody learns at a different pace. Remember that. Remember, you're there to grow, not to be perfect. But don't make rookie mistakes. You don't have a reason to make these type of mistakes, y'all. They are totally avoidable. Clinicals can be intimidating. Clinicals can be scary. Clinicals can be exhausting, but they're also your chance to figure out what type of nurse you want to be. These are a few tips that I'm going to give you to stay motivated during nursing school, so you're not stressed out and ready to quit. Always celebrate your wins. No matter if they're big or small. If you passed the test, celebrate it. If you got your first IV, celebrate it. If you had a great patient interaction, celebrate it. Always celebrate your wins, no matter if they're big or small. That's going to be a way to keep you motivated to get through the nursing program. When I got my first IV, I called everybody. I was so happy, like, I got an IV, Got my first IV on a baby? Oh, you couldn't tell me nothing. Celebrate your wins. Learn from your classmates. Lean on them. They have resources. I remember I was so stressed in anatomy class, like stressed. And I just couldn't figure out. Everybody was passing the test and I wasn't passing the test. And it was because I was studying wrong, okay? But I saw a girl that I knew was doing great in anatomy, and I went to her and asked her, like, can you help me? You gotta humble yourself and just say, can you help me? Can you help me? What are you doing different from me? I don't understand why I can't pass this test. And she was like, oh, okay. She helped me. She gave me resources. She taught me how to look things up. She told me so many helpful things that I did not know. I was just studying wrong, y'all. I was just studying wrong. She walked me through it. I didn't even know that girl. I had never talked to that girl, but I knew she was successful in that class. So I asked for help. Don't feel like you can't ask for help. Always speak positive affirmations on yourself. When I was in nursing school, child, I had sticky notes. I had sticky notes everywhere, all over the bathroom, all over the door. I had sticky notes everywhere telling me I could do it, you know, just speaking life into me because I needed it every single day. So if you need to put the sticky notes up. If you need to put them up, put them up. Put your vision board up. Put stuff up that you can look at every day. Put yourself up in scrubs. Put yourself up graduating. Put yourself up so that you can see it, feel those emotions, and know what it's gonna be like once you get done. All right, y'all, that's the end of this video. I hope it was helpful for you. If it was, please like, comment, and subscribe. Leave a comment down below letting me know if you're in nursing school, you starting clinicals, you just about to finish, you about to take the NCLEX. Tell me something. Leave me something in the comments and let me know that this video was helpful or inspiring to you guys. And if you like this video, please check out the next video that I have linked for you. This video is gonna be helpful as well. And I will see you guys next time. Bye.
Baby girl, you are so pretty.